Well, a warm welcome to this talk. Now, I've been getting lots of questions about this study from Johns Hopkins saying that lockdowns were essentially completely ineffective. And I'm very aware that this has become a bit of a partisan issue in certain parts of the world, such as the United States. So I'm going to try and look at this in an objective a way as I can, and giving the evidence and some counter-argument as well. So let's look at the paper first of all. So this is the paper we are considering here. There we go. So this is a literature review and meta-analysis of the effects of lockdown on COVID-19 with the Johns Hopkins logo, of course. Just published, published in Applied Economics. So straight away we see that this is basically sort of an economic paper. It's written by economists, not by doctors and scientists. Having said that, these people are very good at what they do. They're very good at the statistics. But their primary focus is on the economic issues rather than the medical issues. And the main measure they're using to determine the effectiveness of the lockdowns is deaths. They're not really looking at other factors. But it's still a very good study and a very interesting study, and will be a topic of debate for some time to come, I strongly suspect. So there we go. Let's carry on with it. There you go. Look at it for yourself. I'll obviously put the link in. So they've entitled this "Putting Belief to the Test," which I kind of like that. You know, just because something appears to be true doesn't mean it necessarily is true. So things that are bioplausible, things that you think would work in theory, often don't work in practice. A little bit of practice can undermine quite a lot of theory. So we need to put it to the test, of course. Now, ideally, of course, we put these things to the test with a double-blind, randomized controlled trial. But with lockdowns, I don't really see how that could be possible. But that is another critique of this, that they are critiquing an intervention, but they're using a retrospective way to do that. So it adds to the interest of this, the complexity of it. So bioplausible is not always correct when applied. Early epidemiological studies predicted large effects of non-pharmaceutical interventions. So, for example, the one that's often quoted from the UK, Imperial College London, predicted that based on a lockdown would reduce COVID mortality by up to 98%. And of course, now this is looking pretty weak. Having said that, of course, any of these academics are welcome on, and we'll discuss that. I'm completely open to debate about it. Now, I'm not going to put the references in all the way through this, but this paper does. So that's just one example of the references they put in there. So it's a highly well-referenced paper with good linkages. A systemic review and meta-analysis. So they're taking lots of studies, they're putting these together, and they're coming out with a sort of an amalgam of all the results to determine if there is empirical evidence to support the belief that lockdowns reduce COVID-19 mortality. Well, do they, is the question. Now, lockdowns is the imposition of at least one compulsory non-pharmaceutical intervention, according to their definition. Government mandated, usually, limited movements, closure of schools, business people working from home, ban international travel, all that sort of thing. We'll look at a bit more detail on that in a minute. Systematic search and screening procedure. Now, they looked at 18,590 studies identified. After 3 levels of screening, 34 were ultimately identified. Of the 34 studies, 24 for inclusion in the meta-analysis. So if you actually look at this paper, the way they had criteria for doing this is not as arbitrary as it sounds. It really is quite clever. And I looked at it quite extensively, and I can't say I completely fully understood it. But there's 2 views here. One is we trust the integrity of the authors, which isn't being impugned at all, of course. To follow this technique correctly, but I can't say it was right or wrong because I didn't fully follow it myself. Actually, it is fairly complicated, but we'll assume that they have genuine criteria and came up with this relatively small number of studies. And when you actually read the criteria at the time, they do look more than reasonable. It is a very well written study. 24 for inclusion, so 24 papers, 3 groups of study: lockdown stringency index studies. that looked at how strict the lockdowns were, shelter-in-place orders, which is about the screening studies, and specific non-pharmaceutical intervention studies are what they looked at. And they used the Oxford COVID-19 Government Response Tracker. And this uses 9 metrics to calculate the stringency index. So school closures, workplace closures, cancellation of public events, restriction on public gatherings, closure of public transport, stay-at-home requirements, public information campaigns, restrictions on international movement, and international travel controls. So it's the amalgam of those things that indicate this stringency index for these non-pharmaceutical interventions. And a higher score indicates a stricter response. So 100 is the most strict response. And this is from no less a source than Our World in Data. Check it out for yourself. It's all there. And Our World in Data, of course, has been really quite invaluable to this pandemic, really quite an impressive academic project. Now, 186 countries were initially covered, and then they trimmed that down to countries with over 1 million citizens and came up with 153 countries. So this analysis is basically looking at the whole world, or information that comes from the whole world anyway. An analysis of each 3 groups support the conclusion that lockdowns have had little or no effect on COVID-19 mortality. Wow. So that is where this controversy is coming from. Lockdowns have had little or no effect on COVID-19 mortality is what they are saying. So stringency index studies find that lockdowns in Europe and the United States only reduced COVID-19 mortality by 0.2% on average. Basically, it was the same, wasn't it? 0.2%. Shelter-in-place orders, also ineffective, only reducing COVID-19 mortality by 2.9% on average. Specific non-pharmaceutical intervention studies also find no broad-based evidence of noticeable effects of COVID-19 with lockdowns on mortalities. Now, these graphics here are even more potent, really. This is the one for Europe. So what we've got there is we've got deaths going up and down on that axis, increasing deaths. And here we've got increasing stringency of lockdown up, and so no one was 100% lockdown, but up to 95% there. And what we actually find is if there's a positive correlation, we would expect, if it's +1, it would a 45-degree line. The negative correlation, it would go the other way. But what we actually see here is a very limited amount of correlation. No correlation at all would be a completely flat line. So what we're actually seeing is as deaths rise, or if we say it another way around, as stringency measures rise, deaths also rose slightly. So this is actually showing a positive correlation between deaths and lockdown, not the negative correlation we would have expected. And likewise, from the United States, a pretty similar line. Actually, all these dots are different studies that they looked at, but deaths going up here, increasing stringency going along here. So this is the least stringent here. This is the most stringent here. And we find that increasing stringency led to an apparent increase in deaths. But again, certainly not the negative correlation we had expected. So, I mean, they're not going as far as saying there was a positive correlation that increasing stringency actually increased deaths. But they're saying it basically wasn't effective, and these graphics do fairly strongly support that claim. So pretty revolutionary stuff. And actually, I haven't made a note of it here, but they actually said the World Health Organization apparently in 2006 did a report on the 1918-1919 influenza pandemic, and they concluded there that lockdowns had been ineffective. They weren't extensively used in that pandemic, but the 2006 World Health Organization report did say that they had been essentially ineffective. So it's almost like they're duplicating the findings from a previous pandemic. But it's always a bit more complicated than that. So let's carry on. While this meta-analysis concludes that public lockdowns have little or no public health effects, the authors of this article say, they have imposed enormous economic and social costs where they have been adopted. In consequence, lockdown policies are ill-founded and should be rejected as a pandemic policy instrument. So I don't think there's any too much doubt, really, where these authors are heading to. They're basically saying all this lockdown strategy has been a bit of a economic disaster while accruing essentially no benefit on overall deaths. So you can certainly see why various vested interests might pick up on such dramatic findings. And again, read the report for yourself. I'm interpreting it the way I understand it, and I think you'll probably find you agree with it pretty well. This is what it's saying. We are making their argument. We are reproducing that argument. Now, let's just do a bit of critique on this. We exclude papers which analyse the effects of early lockdowns. So they're not so much looking at early lockdowns as later lockdowns. And of course, this is massively important because we exclude papers which analyse the effects of early lockdowns. And of course, if you lock down late, the virus has already spread. So the earlier lockdown, the more efficacious it's likely to be. And they're the very ones they're excluding. Now, having said that, you can understand that because the lockdowns, you could argue, in Europe and the States and the UK, for example, the lockdowns came late. They were late lockdowns. So they're the ones that are being included in the study. But to talk about the principle of lockdown, you would have to include the early ones as well, I would have thought. So really, we've got two situations here. Do lockdowns work in theory? It doesn't really answer that. I would say the answer is that probably yes. Do lockdowns work in the way we botched it up? Or some might say we botched it up in Europe and the United States, where we were a little bit late, quite a bit late sometimes maybe. You know, this idea that you have to go in hard and you have to go in early for lockdowns to work, whereas we waited till there was not really any choice, and inevitably then the virus is already spreading. So that was an exclusion criteria. So I think that's relevant. We excluded papers to analyse the effects of early lockdowns in contrast to later lockdowns. In other words, you're inevitably going to make lockdowns look worse because later lockdowns aren't working. It was retrospective, and you can pick your own endpoints. Now, in research, I think we call this this is called the Texas sharpshooter problem in research. So the idea is the Texas sharpshooter shoots at the barn door, bang, and then he notices where the hole is. So he then goes and draws his own target round and say, there you go, perfect bullseye. That's kind of that problem, that you can pick your own endpoints. I'm not saying they've done that, but that is a general problem with this sort of retrospective study. Vast array of different countries and circumstances. In other words, there's a great deal of heterogeneity. These are very different studies, very different circumstances. So if we take the compliance in Texas and the compliance in New York and Germany and Italy and China, of course, they're all going to be dramatically different. So can we compare like with like in this? It's a little difficult. Inferences from past to the future. Just because that's worked in the past, it doesn't mean to say we can come to conclusions of lockdown, because there could be a very different scenario in the future. There's a lot of pandemic fatigue, of course. People just got fed up with this and started going around to see their mates. And we know this is a major problem, and most of us obeyed the regulations as we went along. Some didn't. For me personally, my father was in the last year of his life, and I couldn't see him for 6 months of it. He was in hospital for quite a few months and couldn't go and see him. And the way his mental state was at that time, I'm not sure he fully understood that, to be quite honest. So there's a very high price paid by me, and by the majority of us watching. This is really quite an important issue. So, and it's the way that you carry people along. So, for example, Herbie, 2021 illustrates voluntary behaviour changes are essential to a society's response in the pandemic. Accounts for up to 90% of the response. So what Herbie is saying here is about 90% is how you carry people along with you. And to be fair, in the early stages, that was largely done, but now pandemic fatigue has certainly set in. This paper was written by economists, so they are understandably looking at the damage to the economy done by lockdowns, which I don't think really is in debate. Were the papers chosen to support the theme? Well, I really couldn't understand the methodology well enough to understand that. But you could understand if that was a temptation. And of course, it would be great to have the authors on to discuss that. This is a purely open debate. It's nothing. We're not saying anyone's done well or bad. it is an impressive academic paper. Most of the papers used were by economists, not scientists or medical people. So the sort of papers that economists include tend to be papers written by economists, which of course is understandable. Outcomes were solely deaths, did not include cases, hospitalizations and other measures. Now this is probably quite a major point really, because they were looking at deaths primarily. So if we had a situation where we hadn't locked down, then hospitals could have been overwhelmed. Now what would have been the cost of that in people that died who wouldn't have died? Well, many more people would have died. Politically, it would be unconscionable because you could have sick people queuing up, dying outside hospitals, which would not have been, apart from the personal tragedy, politically that wouldn't have looked good. So the lockdowns did even out the admission to hospitals, and they're not really, as far as I can see in this paper, not really taking that fully into account. Again, it's not disingenuous. It's just one paper can only look at a certain amount of material. So cases and hospitalizations, and of course, if hospitalizations had gone badly wrong, more people have died, then that could have had economic effects, and that wasn't really factored in by this paper. Those who are going to die were going to die whether you lock down or not, was the main contention of the paper. Now that's probably true to some extent, but of course we needed to spread this out to prevent hospitals being overwhelmed. And if a lot of people had died all at the same time, who knows what effect that would have had on the economy and on the national mood and on lots and lots of other important parameters. So these are just a few random critiques. The disease itself and largely the fitness of the patient was the largest determinant. Okay, that's probably true. Do not consider, paper doesn't really consider the wider factors that could have affected the economy had there not been lockdowns. Now, I know this is kind of counterfactual history. What would have happened if your mum hadn't met your dad? Well, your mum did meet your dad, so it's kind of counterfactual to think in those terms. But if there not been lockdowns, what would have been the consequences? That is an interesting question. Not sure it's fully addressed by this paper. For example, would mayhem have ensured for hospital capacity and routine medical care without lockdowns? Yeah, there could have been mayhem in hospitals. Doctors and nurses would have had to triage to decide essentially who lived and who died. Not a situation we would want to be in. Not at all. Okay, this is we can always see clearly with a retrospective scope, of course. So it's this idea it's a retrospective study. There's a famous saying in healthcare that, and it's pretty true, of course, the retrospectoscope casts a clear white light. It's easy to see after the event, but not always as easy to see during the event itself. So again, quite easy to sort of sit back from an armchair after. This debate is following party lines, which is unfortunate because there are pros and cons on both sides. There is a growing anti-science feeling, which is unfortunate. Has this fed into it? Yeah, I'm sure this has fed into it. Future epidemic agent could be completely different. And there's a comment from Bella that slipped in, Omicron today keeps Delta away tomorrow, which is probably true, as Omicron has displaced Delta. Anyway, that was just an aside. So this data is showing that the lockdowns didn't result in reduction of fatalities because the people that would have died earlier might have died just a very short time later. But socially, medically, politically, I think it would have been pretty unconscionable to have people dying outside of hospitals, which this could have meant. We needed to flatten that curve out. And I think that's probably the big thing that this paper doesn't take account of, and the economic consequences of that. So if it had been that a lot of people died all at the same time, if a lot of people had died in November 2021, what effects would that have had on the country? I don't think that's really factored in. Of course, as we say, it's counterfactual, we don't know, but it's interesting to think about. But this paper remains, it stands, it's a published, reputable paper, and it's saying that lockdowns were ineffective. Do expect more counter-argument. I've given a perspective on it. I think at the time lockdowns were necessary, Otherwise, a lot of people would have died all at the same time. And more people, I think more people would have died because people that survived because they had medical care. I mean, we think about the British Prime Minister, Boris Johnson. He wasn't admitted to intensive care, but he did have oxygen, I think it was for 3 days. And that probably saved his life. Had that not been available, because 10,000 other people or 100,000 other people or 500,000 other people required oxygen all at the same time, then he could have died. So I think that's the main weakness in this paper. This had to be spread out over a period of time to match the facilities that we had available. Had it not been for that, I suspect more people would have died. A lot more people potentially would have died. So if you are watching this video and you survived after perhaps even fairly minimal medical treatment, had we not had lockdowns, then unthinkably you may not be with us. And if you are in that situation, I'm most delighted you are with us. So there we go, a bit of an extemporary critique, but that's where we're at with that. But interesting. Thank you for watching.